Antigen binding site in immunoglobulin is hypervariable region. Most common infections after splenectomy are by capsulated bacteria. Antigen antibody precipitation is maximally seen in equivalence of antibody and antigen. Antibody that cross placenta to protect fetus is IgG. Rubella vaccine and oral polio vaccine should not be given to an immunodeficient person. Transplacental infection can occur with Treponema pallidum and Trypanosoma gondii. C5a is a complement component which is chemoattractant. CRP is detected by precipitation reaction with carbohydrate antigen. T cells are differentiated from sheep RBC rosette. B cells are differentiated from EAC rosette. B cells have surface immunoglobulins. Major basic protein is formed by eosinophil. Classical pathway C3 converters does not contain C3b. In anaphylaxis, antigen is free and antibody is cell-bound. Alternate pathway C3 convertase, alternate pathway C5 convertase, classical pathway C5 convertase, these all contain C3b. Schick test is a neutralization test. Hyperacute graft rejection is mediated by preformed antibodies. T cell multiplication is stimulated by phytohemagglutinin. The complement system aids the host defense by mediating inflammation, attracting phagocytic cells and activating phagocytic cells. Cytokine is a generic term for protein or glycoprotein released by one cell population that acts as intercellular mediator. HLA-DR is closely linked with rheumatoid arthritis. Immunodeficiency causes repeated microbial infection. Immunodeficiency can lead to increased susceptibility to malignancy. Immunodeficiency decreases response to skin test. Prostaglandin D2 and platelet activating factor are the mediators of hypersensitivity which are formed de novo after cell activation. Complement is present in normal sera. Complement gets activated by antigen-antibody complex. Complement gets destroyed at 56 degrees Celsius for 60 minutes. Properties of antigen-antibody complex include antigen-antibody reaction is firm, binding takes place at surface, only one part and not the whole molecule reacts. Factors that influence the immune complex mediated damage in type 3 hypersensitivity include size of the complex will be formed, local vascular permeability and deposition of complexes in the body. Adenosine deaminase deficiency is seen in severe combined immunodeficiency. Interleukin-1 produces T lymphocyte activation. Decreased C2, C3 and C4 denotes classical complement pathway activation in immunoinflammatory condition. Lymphocyte is not a macrophage. Monocyte, Kupffer cells and microglia, these all are macrophages. Human IgG subclass IgG1 is maximum in serum. In Chidiac-Higashi syndrome, defect is fusion of lysosome. Hereditary angioneurotic edema is due to deficiency of C1 esterase inhibitor. Van der Waals forces, electrostatic bond and hydrogen bond, these all are involved in antigen-antibody reaction. Prozone phenomenon is due to antibody excess. Covalent bond is not involved in antigen-antibody reaction. ELISA, radioimmunoassay and immunofluorescence, these all are the methods of diagnosis which utilize labeled antibodies. Antibody diversity is due to gene rearrangement and mutation. The secretory component of IgA molecule is formed by epithelial cell of lining mucosa. IgG can cross placenta. Interferon inhibits viral replication in cells. Clonal selection is specific. Clonal selection shows generation of diversity of antibody specificity. Secondary response is rapid here. Distal part of alpha chain is the portion of MHC1 complex which forms the component of antigen presenting part. Ova albumin antigen was injected into a rabbit. Here the antibody produced initially is IgM. Role of adjuvant in vaccine includes Activation of both B and T lymphocyte ensures prolonged delivery of antigen, increases both adaptive and innate immune response, stimulation of toll-like receptors. Examples of type 1 hypersensitivity is Cassoni's test. Granulomatous reaction is an example of type 4 hypersensitivity. Disorders of phagocytosis include Job syndrome, Chidiac-Higashi syndrome, myeloperoxidase deficiency, Tuftson's deficiency. Type 4 hypersensitivity includes Lepremin test, tuberculin test, granulomatous reactions. Starting with mycology, Aspergilloma has septate hyphae. Maltese cross seen on polarizing microscopy is seen in Cryptococcus neoformans. Organism which cannot be grown on artificial culture media is Rhinosporidium seaberry. Diabetes mellitus, carcinoma, breast, pregnancy, these all causes candidiasis. The organism most commonly found in intertrigo is Candida. Neisseria meningitis, Streptococcus pneumoniae, Haemophilus influenzae, these all causes pyogenic meningitis. Pheohyphomycosis is characterized by formation of septate brown colored hyphae in vivo. Cryptococcus neoformans has been found most often in soil containing pigeon feces. Commonest fungal cause of corneal ulceration is Aspergillus. Valley fever or desert rheumatism is coccidioidomycosis. A patient resident of Himachal Pradesh presented with a series of ulcers in a row on his right leg. The biopsy from the affected area was taken and cultured on Sabrod's dextrose agar. The causative organism here is Sporothrix schenki. Sporothrix schenki, Blastomyces dermatitidis, Histoplasma capsulatum. These all are fungi that are thermally dimorphic. Infection with Sporothrix schenki is an occupational hazard for gardeners. The portal of entry for this organism is via skin. Inhalation of fungal spores of Coccidioides immitis can cause primary lung infections. Tinea versicolor is caused by Malassezia furfur. Sclerotic bodies are associated with chromoblastomycosis. A florist presents with a lymphocutaneous infection of the right hand and forearm. Most probable fungal etiological agent is Sporothrix schenki. Penicillium marneffi is a yeast which divides by binary fission. Tissue should not be minced during processing for isolation of mucor species. ID reaction is associated with dermatophytes. A preterm low birth weight infant delivered by LSCS after IVF was put on ventilator in NICU for severe RDS. The respiratory distress subsided on day 7 and TPN with lipid formulation was started from day 10. The neonate developed signs of sepsis on day 15. The most likely causative agent is Malassezia. Cell wall of fungus contain chitin, mannan and glucans which are not seen in bacteria. Echinocandins are cell wall inhibitors. Sporulation in fungus is for survival as well as reproduction unlike bacteria. Histoplasma capsulatum, Blastomyces dermatitidis, Coccidioidomyces immitis, these all are thermally dimorphic fungi. Blastospores, arthrospores, chlamydoconidia, these all are asexual spores. A premature infant born at 24 weeks gestation after IVF had a birth weight of 800 grams. Oxygen was instituted by head box due to recurrent apnea. TPN was instituted with both amino acid and lipid formulation. After 10 days, the baby developed signs of sepsis, but blood culture was negative. However, blood culture for fungus revealed a fungus with round oval cells and short hyphae. The causative agent is Malassezia furfur. Dermatophytic infections are confined to keratinized tissues. ID reactions seen in dermatophytes are due to aggressive treatment with terbinafine. It is common in children. Incidence rate is 5%. Hair perforation test is positive in trichophyton mendegrophyte. Sporothrix schenki is a dimorphic fungus. It spreads via lymphatic to produce a series of ulcers. Most common risk factor is thorn prick. A chronically ill young white male is unable to work due to his frequent illness. He spends most of his time raising and training pigeons. He develops a mild pulmonary infection and eventually presents to his primary care physician with headache, mental status changes, and fever. A clinical diagnosis of meningitis is confirmed with a latest on CSF for capsular polysaccharide antigen of the organism. The best screening media for this organism for isolation is Niger seed agar. This is done to check melanin status. Diagnosis is cryptococcal meningitis. In chromoblastomycosis, sclerotic bodies are pathognomic. Systemic invasion is very rare. Demeticious fungi are the etiological agent. In eumycetoma, tumor mass is usually single and well defined. Causative agents are hyaline and pheoid fungi. Opening of sinuses are flat and not flared up. Next question. Histoplasma capsulatum, a dimorphic fungus, is found in soil heavily contaminated with bird droppings. Oval budding yeast inside macrophages best describes the presence of organism in tissue biopsies. African histoplasmosis is caused by Histoplasma capsulatum barboisi. Yeast are larger and thick-walled. Here, pronounced giant cell formation in infected tissue can be seen. Aspergillus is best described by widespread in environment. Conidia may be inhaled microscopic appearance in specimen which reveals dichotomous branching and septate hyphae. A ventilated patient in ICU develops invasive aspergillosis and is put on voriconazole. The best way to diagnose invasive aspergillosis in this case is serum beta-galactomannan. Febrile neutropenia is seen in infection with Candida. Mycotoxin can cause carcinoma colon. The nail clippings of a chronic infected nail subjected to 10% KOH showed plenty of fungal hyphae and on culture yielded a fluffy white mycelial growth in 10 days, which on LPCB mount exhibits club-shaped macroconidia in clusters, few chlamydoconidia and no microconidia. The most probable dermatophyte is Epidermophyton floccosum. An HIV-infected person from Manipur of India with a CD4 count of 75 cells per ml presented with molluscum contagiosum-like lesions on face and upper trunk. Aspiration cytology revealed both intra and extracellular septate yeast and culture yielded a dimorphic fungus. The most likely agent is Penicillium marnefi. Mucicarmin stain is used for Cryptococcus. PAS stain is used for Sporothrix schenki. Methenamine silver stain is used for Histoplasma. Reynolds broad phenomenon is demonstrated by Candida albicans, Candida dubliniensis. Aflatoxins are produced by Aspergillus flavus. Dermatophytosis is caused by Trichophyton. Tinea pedis is caused by Epidermophyton floccosum. Fungal cell wall contains chitin. Fungal cell wall does not contain peptidoglycan. Fungal cell wall prevents osmotic damage. Trichophyton species, which is anthropophilic, includes Trichophyton tonsurens, Trichophyton wileatium, Trichophyton schonlini, Trichophyton mendegrophytes. The capsule of Cryptococcus neoformans in a CSF sample is best seen by Indian ink preparation. Latex agglutination test of the antigen in CSF helps in the diagnosis of Cryptococcus. Cryptococcal meningitis is common in renal transplant recipient. Pneumocystis carinii is a fungus because it contains rRNA, mitochondrial protein gene sequence, and presence of thymidylate late synthase. Pass dye is most suitable for fungus demonstration in biopsy. In HIV-infected individual, gram stain of lung aspirate shows yeast-like morphology. Here we can suspect organisms like Candida tropicalis, Cryptococcus neoformans, Penicillium marnifi. Pneumocystis carinii is fungus. Rhinosporidium seaberi is protozoa. Pneumocystis carinii is diagnosed by silver nitrate staining. Blastomycosis is characterized by yeast-like fungus. It is dimorphic fungus. Here it commonly involves lung and skin. Important feature used for identification of Cryptococcus neoformans is it hydrolyzes urea. Reynolds Broad phenomenon is seen in Candida albicans. Cryptococcus is the only yeast. Next question. In a patient, corneal scraping reveals narrow-angled septate hyphae. Here the etiological agent is Aspergillus. An early diabetic has left-sided orbital cellulitis. CT scan of paranasal sinus shows evidence of left maxillary sinusitis. Gram-stained smear of the orbital exudate shows irregularly branching septate hyphae. Most likely etiological agent is Aspergillus. Common fungus causing corneal ulcer is Aspergillus. Next question. A young woman complains of recurrent rhinitis, nasal discharge and bilateral nasal blockage since 1 year. She also had history of allergy and asthma. On examination, multiple polyps with mucosal thickening and impacted secretions are seen in nasal cavities. Biopsy was taken and the material on culture showed many hyphae with dichotomous branching typically at 45 degree. The most likely organism responsible is Aspergillus. Rhizopus is an aseptate fungus. Next question. Aseptate hyphae is not seen in Aspergillus. Aseptate hyphae is seen in Rhizopus and Mucor. A series of ulcers in lower extremities in sub-Himalayan area is often caused by Sporothrix schenckii. A gardener has multiple vesicles on hand and multiple eruptions along the lymphatic. Most common fungus responsible is Sporothrix schenckii. Darling disease is caused by histoplasma. pH of Sabro's dextrose agar is adjusted to 4 to 6. 10-year-old female patient with thalassemia and diabetes is admitted to ICU because of sudden swelling on the right side of the face and an episode of bleeding from the right nostril. She had recently developed signs of ketoacidosis and renal insufficiency. Her blood sugar level at the time of admission is 700 mg per deciliter. The facial lesion becomes partially necrotic and shows slight protrusion of the right eye and facial paralysis. The patient dies on the second day. Histopathologic examination of the lesions reveals occlusion of the small vessels and the presence of non-septate hyphae. The most probable cause for this is mucormycosis. Breakthrough zygomycetes infection can occur during pulmonary invasive aspergillosis following treatment with voriconazole.